Now to the coronavirus pandemic. Anyone 16 years and older is now eligible for a vaccine in the U.S. More than half of all adults nationwide have received at least one dose, and more than 25% of the population is fully vaccinated. Still, the head of the CDC says the nation is in a, quote, complicated stage. More people are getting vaccinated, but infections are climbing in parts of the country, especially among children. Meg Oliver reports.
For months, I've been telling Americans to get vaccinated when it's your
Tonight,
turn.
as cases remain stubbornly high in some parts of the country, the White House is renewing its push to convince Americans that getting vaccinated is the only way out.
The lack of supply, the shortage of locations, the confusing rules are all in the past.
In places like West Virginia, which led the way with rollouts, there's already been a drop-off in shots just 4 months after the first vaccine was authorized. For health officials like Krista Capehart, the push to vaccinate now means long drives on country roads.
We definitely have to develop programs that are patient convenience driven. So we have to take the vaccines where the patients are.
Half of American adults have now been vaccinated with at least one dose, but there is increasing concern tonight over hesitancy, especially in wake of Johnson & Johnson pausing its rollout while regulators investigate why at least 8 recipients developed extremely rare but dangerous blood clots. Today, federal officials repeated overwhelming evidence that the vaccines are safe.
What we say to anyone who has doubts about getting a vaccine, we leave it up to you. Look at the data. The data speak for themselves.
To encourage vaccinations, New York City will offer shots under the famous blue whale at the American Museum of Natural History. Meanwhile, 13 states saw a rise in new cases in the last week. And cases in children are spiking too. Last week was the highest total in 2 months. 1 in 5 new infections were kids. New Jersey has the second highest number of new cases per capita in the nation.
Why is New Jersey still ranking so high?
One thing is the new variant, the UK variant, extremely transmissible, very infectious. And I think people, of course, have quarantine fatigue. They're taking off their masks. They're opening up schools. They're going back to activities.
As that race to vaccinate continues here at Holy Name Medical Center in New Jersey, which was a Johnson & Johnson site, officials tell us since the pause, they've seen a decrease in registrations up to 20%, which they attribute to hesitancy. Elaine?
Meg Oliver, thank you. Joining me now is infectious disease physician Dr. Hlatshwayo Davis. Doctor, welcome. Thanks very much for being with us. More than 25% of the U.S. population is fully vaccinated, and anyone 16 or older is now eligible. What is our biggest obstacle at this point in getting control of this pandemic?
Our biggest obstacle is just understanding that we're not there yet. We cannot ease up because we're excited about getting a vaccine or having received one. I think public health officials and medical experts have made it very clear that while the vaccine is the most important tool in our toolbox, it's by no means the only one. We have seen that folks are not masking as often, social distancing, and are re-engaging in more and larger group activities, and that just cannot afford to happen until we've reached herd immunity. And so that is the risk that we're running here. We're seeing a lot more vaccines being given, and this is phenomenal news. But we're also seeing infections up, which means we are not doing everything we should be doing to contain this.
Well, Dr. Anthony Fauci believes that we're going to get a decision on the Johnson & Johnson vaccine by Friday. Now, the vaccine makes up a small fraction of the more than 200 million doses administered in the U.S. Will this pause still be damaging to our vaccination efforts? And if so, in what ways?
Well, the White House has assured us that between Pfizer and Moderna, the U.S. has enough vaccinations to keep up with the daily vaccination rates that we have been keeping up with. We still have the capacity to vaccinate approximately 3 million people a day. And we, as of today, any adult 16 and older can have access to a vaccine. We know that we have the capacity to be able to vaccine all adults by mid-May, and certainly all adolescents and adults by the end of June. And so really there isn't a distribution issue at this point.
And doctor, I want to ask you about something we've been hearing about in the news. Some COVID long haulers, meaning people with lingering health issues from the virus, say the vaccine has eased their symptoms. Can you explain why this might be?
This is really interesting and exciting news. I always am cautiously optimistic. I always say that we need to follow any signal with rigorous science and data to back it up. But certainly this phenomenon has been described in a large number of patients, so much so that researchers across the country, we know that at UCSF this research has started and in other places too, to see if there is any causality, meaning, is this something we're just seeing as a coincidence? Is this a placebo effect? You know, people are just so happy to be getting the vaccine that it has a positive impact, or is there a link? Can we establish a cause? And some of the potential reasons that people think this may be occurring, if there is a causal link, is it could be that the vaccine, by introducing this immune response, deals with some of the remnants of the vaccine that are circulating within the body to cause the symptoms, or is helping to boost the immune system such that it is able to deal with these leftover symptoms, or finally that it may have a certain resetting of the immune system. Either way, I still say that folks should maybe follow my lead and be cautiously optimistic, and that we don't make any inferences or any final decisions about what this may or may not be until scientists have had a chance to perform the rigorous science that we know we need.
Right. As you point out, so many open questions remain at this point. Nevertheless, cautiously optimistic, I think, is something that a lot of people will gladly take at this point. I want to take a step back and talk about what we're seeing around the world, Doctor. Global coronavirus cases have increased for an 8th consecutive week. Which areas of the world are of most concern right now, and why?
Undoubtedly, the places that are most concerned are places that we call low-income and middle-income countries. These are countries that have not had access to the same vaccine supply as we have. Here, the U.S. is highly fortunate and benefits from the privilege of being able to obtain vaccines such that we can speak of the type of numbers we spoke about earlier in this show, where any adult who wants a vaccine should have access to it. That is not the case around the world, where in countries like the country I was born in Zimbabwe, there is less than 5% access to a virus, and this is true of most low-income countries. This is devastating. Pandemics do not end unless there is global equity. That has to be achieved. So one of the things that I have been most happy to see coming from the highest levels of leadership from the White House is a commitment to not only funding the COVAX initiative around vaccine distribution globally around this type of equity, but also saying we will make ourselves available to not only fund, but to be leaders in being thoughtful about how this can be done in a meaningful way. Again, pandemics don't end unless there is vaccine equity. Any place that is in danger poses a threat to us all.
Right, and it is so troubling to see just how large those disparities are around the world. Dr. Hlatshwayo Davis, Doctor, thank you very much for your insight and expertise. We appreciate it.
Thank you. Great to be back.